Hello, welcome to Advancing Health Literacy, Improving Spoken Communication for Health Outreach Workers. This is the first in a series of trainings brought to you by the New Haven HEAL Initiative. The New Haven HEAL Initiative aims to improve health outcomes for New Haven residents, to reduce COVID related disparities, and to increase patient engagement in their healthcare. You may have the question, what is health literacy? Health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health related decisions and actions for themselves and others. As a health outreach worker, you have been tasked with conveying important health information to residents. You may even be getting questions regularly regarding the COVID-19 pandemic. During today's training, we'll be discussing some ways your organization can improve the health literacy of New Haven residents. We'll be going over several useful tools to improve the spoken communication at your organization to improve health literacy for all. Tool number one is to form a team. The first step is to identify key team members to join. Include one motivated and respected representative from each area of your agency. Keep the size of your team manageable. Incorporate residents into the team if possible. Next, you'll want to bring team members together. Schedule regular team meetings at your organization and report progress to leadership on a monthly basis to maintain accountability and team engagement. Tool number two is to create a health literacy improvement plan. First, you'll want to review and complete a health literacy assessment. You've already completed this assessment prior to today's training. Collect assessment data, discuss responses, and discuss opportunities for improvement. You may want to pay attention to responses that were previously unknown and surprising, for these may represent opportunities for improvement. Next, you'll want to develop a health literacy improvement plan. Develop a clear and written action plan to ensure the health literacy team remains on the same page throughout implementation. Tool number three is raising awareness. Conduct an education session at your organization. Be sure to allow time for discussion and an opportunity for everyone to discuss practice experiences. Discussion of such experiences can both raise awareness and engage staff. Other actions you can take are pursue continuing education credits in health literacy to help you maintain health literacy awareness. For this next section, we'll be discussing some tools you can use to improve spoken communication when engaging with residents. Tool number four is clear communication. Try these strategies for communicating clearly when engaging with residents. Greet residents warmly. Receive everyone with a welcoming smile and maintain a friendly attitude throughout the interaction. Make eye contact. Make appropriate eye contact throughout the interaction. Consider culture, customs, and beliefs to maintain cognizance of the resident's preferences. Listen carefully. Try not to interrupt residents when they are talking. Pay attention and be responsive to the issues they raise and questions they ask. Use plain, non medical language. Don't use medical words. Use common words that you would use to explain information to your friends or family, such as stomach or belly instead of abdomen. Use the resident's words. Take note of what words the resident uses to describe his or her illness and use them in your own conversation. Slow down. Speak clearly and at a moderate pace. Limit and repeat content. Prioritize what needs to be discussed and limit information to 3 to 5 key points and repeat them. Be specific and concrete. Don't use vague and subjective terms that can be interpreted in different ways. Show graphics. Draw pictures, use illustrations, or demonstrate with 3D models. All pictures and models should be simple, designed to demonstrate only the important concepts without too much detail. Demonstrate how it's done. A demonstration of how to do something may be clearer than a verbal explanation. Invite resident participation. Encourage residents to ask questions and be involved in the conversation to be proactive in their healthcare. Encourage questions. We'll go over this in further detail in an upcoming training. Apply Teachback. We'll be discussing the Teachback method next. This is a great tool to be used to communicate clearly with residents. Using clear oral communication strategies can help your residents to better understand health information. Communicating clearly also helps residents feel more involved in making decisions about their health and increases their likelihood of following through on taking health-promoting actions. Tool number 5 is the Teachback method. Studies have shown that 40 to 80% of the information residents are told during office visits is forgotten immediately, and nearly half of the information retained is incorrect. The Teachback method is a way of checking understanding by asking residents to state in their own words what they need to know or do about their health. It is a way to confirm that you have explained things in a manner residents can understand. The Teachback method is a valuable tool for everyone to use with each resident. These methods can help you improve resident understanding and adherence, decrease callbacks and canceled appointments, and improve resident satisfaction and outcomes. The first thing you'll want to keep in mind is that this is not a test of the resident's knowledge. It is a test of how well you explained the concept. Plan your approach. Think about how you will ask your residents to teach back information. For example, we covered a lot today, and I want to make sure that I explain things clearly. So let's review what we discussed. Can you please describe the 3 actions you can take to help prevent the spread of COVID-19? Chunk and check. Don't wait until the end of the interaction to initiate teachback. Chunk out information into small segments and have your resident teach it back. Repeat several times during the interaction. Clarify and check again. If teachback uncovers a misunderstanding, explain things again using a different approach. Ask residents to teach back again until they are able to correctly describe the information in their own words. If they parrot your words back to you, they may not have understood. Start slowly and use consistently. At first, you may want to try teachback during your last interaction of the day. Once you are comfortable with the technique, use teachback with everyone every time. Practice. It will take a little time, but once it is part of your routine, teachback can be done without awkwardness and does not lengthen a visit or interaction. Use the show me method. When explaining a new preventative measure, research shows that even when residents correctly say when and what to do, many will make mistakes when asked to demonstrate the action. You could say, for example, I've noticed that many people have trouble remembering how to correctly wear a mask. Can you show me how you are going to wear it? Use handouts along with teachback. Write down key information to help residents remember instructions at home. Point out information by reviewing written materials to reinforce the resident's understanding. You can allow residents to refer to handouts when using teachback, but make sure they are able to use their own words and are not reading the material back verbatim. Be sure to promote the use of teachback at your organization. Share teach-back stories so that everyone has a chance to share their effective techniques and be reminded of the importance of using teach-back consistently. Tool number 6 is following up with residents. Appropriate follow-up can help you identify misunderstandings and answer questions, or make further assessments and adjustments. In addition, follow-up helps to promote a good working relationship between you and your residents. First, you'll want to decide on the reason for the follow-up. Some examples are to reinforce knowledge and action plans and verifying follow-through on referrals. Ask residents to record information. An excellent way to monitor health is to have residents track key values and share that information with you between visits. For example, a resident may have scheduled both doses of their COVID-19 vaccine at once. You can help them to remember these dates by having them record the information and asking about the dates during follow-up calls or meetings. Be sure to thank residents for recording this information, highlighting how helpful it is, and providing positive feedback. Identify who will follow up with residents. If you've referred a resident to a community clinic and the clinic hasn't reached out to them yet, assign someone to focus on these types of follow-ups. Administrative staff can also follow up with residents about future appointments, clarify information sent through the mail, and provide residents with information about community resources. Choose the ways your office will follow up. Talking on the phone allows residents to ask questions and staff to reiterate important points. If sending an email, make sure your emails are easy to understand and be sure to tell residents when and how often you check email. Text messaging can also be effective for sending reminders and answering quick questions. If sending results or other information through the mail, make sure it is easy to understand. Automated calling systems can also be used to send information to your residents. Initiate and track follow-up. Work together with other staff to identify the types of residents who would benefit from follow-up. Identify the appropriate schedule for follow-up. Establish systems for tracking follow-up, such as through an electronic record or by using a computer-based calendar. Identify the staff members who will update these tracking systems. Finally, note what is achieved. Tool number 7 is improving your telephone system. Assess your telephone system. Call your practice as if you were a resident, both during and after business hours. Some questions you can ask yourself are: did you get a busy signal? How long did it take to reach the staff member or obtain the information you wanted? If using an automated system, were the menus easy to understand? Were you put on hold? Were you instructed to call another number? Questions like these are helpful when assessing your telephone system. Be sure to also ask your residents about your phone system. What comments do they have? The next step is to improve your telephone system. Decide whether to implement an automated telephone system if you don't already have one. If you opt for an automated system, offer choices in the languages commonly spoken by your residents. Always have an option to speak to a person, and create a menu with no more than 5 choices. If you opt to have a person answer the phones, set policies for how quickly phones should be answered, checking back with people placed on hold after a set period of time, transferring calls, and offering to take messages or transfer to voicemail. Have a schedule to ensure phones are covered throughout office hours. If your office closes for lunch, have a message on your machine with the hours you are closed. Improve how well your staff communicates on the phone. Develop and use written scripts with responses to frequently asked questions to assure that clear, consistent answers are provided. You can always refer back to tool number 4 to assist with communicating over the phone. Encourage staff to confirm resident comprehension by using the teach-back method to ensure instructions given over the phone were understood. Make use of telephone interpreter services for residents who need language assistance. Educate residents about the phone system. Create and distribute a brochure that explains when and how to contact your agency, both during and after business hours. If a resident needs to contact the agency for something specific, for example, to talk to a specific staff member, tell the resident exactly what he or she should do. Tool number 8 is preparing for brown bag reviews. The brown bag review of medicines is a common medical practice that involves encouraging patients to bring all of their medicines and supplements to their visit and reviewing them. The goal is to determine what medicines patients are taking and how they are taking them. The process can identify medicine errors and misunderstandings that would otherwise be overlooked. Where do you come into this equation as a health outreach worker? While you may not work in a clinical setting, you may find yourself connecting residents with medical services and asking them about their medical needs. If you are ever tasked with helping a resident with their medicine and getting them set up for a doctor's visit, understanding the brown bag review can be helpful. If a resident is struggling with their medicine, suggest they ask their doctor for a brown bag review and help them prepare. Before a resident's brown bag review, they will need to prepare for their visit. This is done by identifying all medicines a patient should bring. You can help a resident ensure they have all medicines together for their doctor's visit. If the resident asks more specific questions about medications, do not attempt to provide medical advice. Have them write down any questions so that they can have their questions ready for their doctor. If a resident is in need of a brown bag review, suggest that they request one from their medical provider. Emphasize the potential benefits, such as a possible reduction in the number of medicines they take. Once you have helped the resident prepare and they arrive at their review, their medical provider can then go through each medication one by one and ensure that the resident understands why they are taking the medicine, when they are supposed to take it, and how much they should take. Throughout the process, use the word medicine rather than medication. Medicine is a common word and is more likely to be understood by all residents. Tool number 9 is addressing language differences. Residents who do not speak English very well often do not get the health information they need. Addressing language and sensory differences is an important part of addressing health literacy and is required by law. One strategy you can use to address language differences is to assess language preferences and language assistance needs. Ask all new clients what language they prefer to speak and read and if they would like an interpreter. Record their language assistance needs in their records. For residents who do not speak enough English to respond to questions about language preference, use I speak cards to identify the language they speak. Match residents with qualified bilingual staff members, or request an interpreter for residents who do not speak English very well or who appear to have difficulty understanding English. Display interpreter services posters in your waiting and reception areas to make residents aware of the availability of free interpreter services. Use acceptable language assistance services. Acceptable language assistance services include the following. Bilingual staff members whose proficiency has been confirmed can communicate directly with residents in their preferred language. Staff who are trained as interpreters. on-site trained interpreters, and telephone or video interpreter services. All staff and interpreters should understand the importance of using plain language. See tool number 4 for guidance on communicating clearly. Do not use unacceptable language assistance services. Individuals who are not trained to be an interpreter make more significant mistakes. Unacceptable language assistance services include the following: staff who are not trained or certified as interpreters, the resident's family and friends. Using family or friends poses a problem with privacy. In addition, family or friends may provide you with their own views of what residents say or feel about their problems. If a resident insists that a family member serve as an interpreter, you should respect that request. But a qualified interpreter should also be present to assure that information is accurately relayed. Minor children should never be used as interpreters. Plan for interpreter services in advance. Use data about residents' language preferences to determine how to best meet their language assistance needs. For agencies with small populations of non-English speaking residents, consider scheduling appointments and having call-in hours on specific days or times when appropriate interpreter services are available. Provide written materials in residents' preferred languages. Do not assume that non-English speakers will understand notes or other materials written in English. Decide what to translate, such as signs, forms, and instructions. Obtain multilingual health education materials. When you can't obtain materials in residents' preferred languages, enlist the help of interpreters trained in sight translation. Sight translation is reading a written document aloud in a different language from the one in which it is written. Pursue sources of payment for language assistance services. Investigate whether insurers will pay for or have negotiated discounts with interpreters. Contact community organizations to see if they can provide volunteer-trained interpreters. Develop contracts with language assistance services that can be shared among several agencies. You can also apply for grants to support interpreter services. Tool number 10 is considering culture, customs, and beliefs. Religion, culture, beliefs, and ethnic customs can influence how members of our community understand health concepts, how they take care of their health, and how they make decisions related to their health. For example, in some cultures, people believe that talking about a possible poor health outcome will cause that outcome to occur. In some cultures, family members play a large role in healthcare decision-making. Differing roles of women and men in society may determine who makes decisions about accepting and following through with medical treatments. Religious faith and spiritual beliefs may affect healthcare seeking behavior and people's willingness to accept specific treatments or behavior changes. Disease-related dietary advice will be difficult to follow if it does not conform to the foods or cooking methods used by the patient. Eye contact or physical touch will be expected in some cultures and inappropriate or offensive in others. Without proper training, professionals may deliver medical advice without understanding how health beliefs and cultural practices influence the way that advice is received. Asking about residents' religions, cultures, and ethnic customs can help you engage with residents so that, together, you can help them meet the medical care needs that are consistent with the residents' values. Learn from residents. Respectfully ask residents about their health beliefs and customs and note their responses in their records. Address residents' cultural values specifically in the context of their healthcare. Avoid stereotyping based on religious or cultural background. Understand that each person is an individual and may or may not adhere to certain cultural beliefs or practices common in his or her culture. Asking residents about their beliefs and way of life is the best way to be sure you know how their values may impact their care. Learn from other sources. High-quality online resources provide education about cultural competence, both as a general topic and as related to specific groups. There are many courses, videos, and websites available as well. Community organizations such as religious institutions and cultural organizations can often provide information and support to help make your practice more culture friendly. Invite a member of a relevant cultural group to attend a staff meeting and share observations about how cultural beliefs may impact healthcare. You can also invite an expert to conduct an in service training to educate staff about cultural competence. Integrate cultural competence into orientation and other trainings. Take advantage of opportunities to integrate cultural competence into all of your training activities. You can also use interpreters as cultural brokers. Interpreters can eliminate language barriers as well as help you and your residents avoid misunderstandings due to cultural differences. Help staff learn from each other. To raise awareness about cultural competence among your staff, you could hire staff that reflects the demographics of your resident population. These staff members can help contribute to a comfortable environment for residents and can share insights with other staff regarding the customs of their religious or ethnic groups. Encourage staff to complete online cultural competence trainings and share what they learned with each other during a staff meeting. This concludes today's training on improving spoken communication. Be sure to try these tools out. This training is brought to you by the New Haven Health Education and Literacy Initiative, led by the New Haven Health Department. Join us for our next training coming soon on improving written communication.